Mahendra, it is a great initiative, and it will bring everybody to the same platform and look at the different viewpoint when doing it. Well, Nadiad is a small district place, 300,000 people, and but we have the super specialty hospital in kidney, we have a super specialty hospital in heart, then we have a super specialty hospital in dental surgery and in pharmacy, so it's an educational center. And we also acquired Robot in 25th September 2010. And we are only looking at the urology, nephrology, and transplant. And this robot is used for all the patients, irrespective whether they can afford or not afford. So, for such a venture in a small place, we have to pray to the Lord Ganesha, to have his blessing. And then we started with the awareness program, and we managed to develop a 3D transmission in our own auditorium with our own engineer did it, and we had our first inauguration, and then Mihir demonstrated a very nice partial and radical prostatectomy, and then we been sent to the Strasbourg in France for a training, and Arvind, which is in the middle here, he is the one who's actually in charge of the robotic department. This is Mishra, he is in charge of the oncology, and I'm there to just help them out. And after doing the training, Mihir came down and almost every month for 6 weeks for a weekend, and then we lined up 4 or 5 cases, and then he would do and demonstrate, and we learn the small intricacy from him. Though we were doing laparoscopy, we had a very large volume laparoscopic surgery, but then he helped us, and then after about 20-25 cases, we took it over, and then he used to mentor us in going through the procedure. Now we are our own, and now this is the team which we have developed, and these are the staff, dedicated staff, anesthetists, and all other team. And this is very important. This is a teamwork, and each and every person on the team really counts for us to have a smooth procedure. Of course, the financially robot is an expensive thing, but luckily we had a very large stone center, and we have a large amount of transplant we are doing it, and that too department supported our robotic surgery. During our time, slowly we realized that end of last year, the dollar is crushing. I mean, the rupees is crushing, and dollar price is going up. So it affects everything, because we had borrowed the loan from the bank, and then every 10 surgery you have to buy equipment in dollar, and that price again is more. So so we did. After all, we are Gujarati. So what we did, we paid off. We paid off the entire amount in January, and today, if I calculate, we are supposed to pay the first installment, because with 3 years moratorium period, we have to pay in the first installment in September, and we realized that we saved 1.5 crore rupees. So now working on a market, you have saved the money, and now so this is what it should be. I would request that this disposable which we have to buy, probably you also store it here, so it becomes cheaper, because otherwise the price is going to, they tell me it is going to be 80 rupees eventually. So we had a center for robotic surgery here again, like Verticity Foundation. We have our videos put on to this, people see it, get them educated, and then most important, we also had a distant learning and training, and we webcasted. And this is the first webcast we did, where 3,900 hits were there all over the world, and this was the country which had this thing. This helps us building up our own confidence and our own setup, and at the same time make them aware. This is our auditorium. Now, if you see the surgery we have done so far is 358, 170 robot-assisted prostatectomy, robot-assisted partial nephrectomy is 73, then robotic-assisted pyeloplasty is 46. I tell you, nearly the same number probably would be in the laparoscopy, because we have 12 residents, 2 fellows, and not everybody is get chance in doing robot, but we have to teach them the laparoscopic surgery, and we make sure that they do laparoscopic surgery before they leave. The fellows, they are supposed to do 100 cases before they get a fellowship. So they do mostly laparoscopy independently, and then they assist robotic surgery. So they have both the thing, and then if opportunity comes to them to have a robot or work in the institute where there is a robot, it would not be difficult for them to pick it up. But still, unfortunately, when we bought a robot, the simulator didn't come with it. Nowadays, I believe the simulator comes with the machine, and so that is one of the things we cannot teach the student. I know Mahendra said many years ago, is a criminal waste of the clinical material if you don't teach it. But then this is not in a hand, because if you go and buy the separate thing, it costs almost 2 crores rupees. So we have to see. Now, so pyeloplasty, then radical nephrectomy 31, but I'll tell you probably double the amount is we are doing it laparoscopically, because that does train the student well. Robot assisted cystectomy 19 out of 19 we have done cystectomy part about 5-6, but we have and the remaining part is done by the Mihir in this thing. So anyway, you see all that list in small way we are doing it, and I do believe that the robot does make difference in our approach to the disease and the patient's well-being. We have lots of plan for expanding it, our services and our expertise. I'm sure we'll be doing that. Thank you.